Hello everyone! Today I will tell you how to literally unblock the neck, remove pain, and significantly increase the amplitude of movement in the cervical spine in a few minutes. Let's go! Very often when we start to have neck pain, the first thought is hernias, bites, osteochondrosis, or displacement and blockage of the vertebrae. But most often it is just a muscle imbalance of the musculature that controls the neck. For the neck to move well, all the muscles that attach from the torso to the neck must be in the correct, balanced tone. Most importantly, it's quite easy to test. If you have a problem with grinding or large protrusion, then there is pressure on the nerve root, then the pain will almost always give in the hand and most often even below the elbow joint. If the pain is shooting acute, which gives in the hand, definitely do a magnetic resonance imaging and see a doctor. If the pain is mainly in the neck or gives in the head or in the chest department of the spine, then most likely it is musculature. For every movement, there are key points that block it. And to start, you need to check the rotational movement in the neck. Try to stand straight and turn your head to one side and the other. For example, when turning to the right, the amplitude is significantly less and you feel pain. This pain can be from the other side of the back or from this side or even from the side. This is not so important. After this, it is necessary to find and check the pivot point, which most often prevents the head from turning. The most common point will be in the middle of the clavicle, slightly lower, literally one finger. If you look at the skeleton, approximately here is the middle of the clavicle slightly lower. Here we first look for the point on the side where the head does not turn. Palpate it. Remember, if you find a disease there, leave your hand pressed to this point and turn your head again. If the point is really blocked and interferes with the turn, then when you put your hand on it, the head turn will increase and the pain will decrease. This means that we are putting this point to work. This point often works, but if after its processing there is still some limitation of neck mobility, or this point did not work, then we will try another rotational point, which is located on the spine. For this, it will be necessary to palpate the axis of the blade, that is, such a protruding bone, go over it with your hands. And at the edge of the bone, you can find a disease thickening. That is, go along the bone and palpate the diseased area here. If you found a diseased area, you can hold your hand there or ask someone to press this point and turn your head again. If this gives additional relief, then this point will also be worked on. If these points did not improve the turn or did not work, we still have one more point in reserve. To find it, you need to run your hand along the angle of the lower jaw to the neck and try to feel the muscles on this level of the back surface of the neck. Where they transition to the lateral surface, in this zone, you can feel a pathological thickening. By the way, I have it there. If you found a disease in this zone or on the opposite side in this zone, be sure to massage these points. It's most convenient to work on the points with the help of balls for myofascial release. They come in different densities. If the ball is solid rubber, it presses harder. There are softer balls. You can also use a tennis ball. Set the ball on the door jamb for convenience and find the first point. Set the ball on the first point and just press at first. Most often, the first 15 seconds are very painful. Radiation can also occur at this moment. That is, there may be some sensations in the hand or in the head area. This is normal. We wait for about a minute. After a minute, this area will already warm up and relax. You can start the dynamic part of the workout. That is, we start to slightly move the ball up and down, not going on to the key. And right, left. In dynamic work, the pain can also return. It is necessary to work out this point for about 1 5/10 to 2 minutes until the pain disappears. After the pain at the point has passed, try again the amplitude of movement in the neck. Not only the rotation can improve, but also the tilt and side inclination. If the amplitude did not work out, then we move on to the next point. To find the second point, we find the axis of the blade, follow it. When the axis ends, we find the pain zone. We set a ball there and also lean against the wall or door jamb. When we found the ball, we repeat the procedure from the first point. That is, we continue for a minute, and then we start slow movements up and down and small movements to the right and left. The movements should be small, literally about half an inch to each side. When the pain subsides, check the head movement again. To find the third point, slide your hand along the lower part and go to the same level on the neck. The point is located at the transition from the muscles that bend the neck to the muscles that tilt the neck. So essentially right here, you can search a little. This is where I have this point, right in this zone. It's best to use 2 fingers. First press on it and wait for about a minute. After the pain subsides a bit, start moving your fingers back and forth, up and down, until the pain completely goes away. Radiation can also occur. That is, the pain can go to the head, to the eye, to the ear. Don't be afraid, this is a temporary process, and it says that the point is really important and active. When these sensations go away, be sure to check the head movement. If something still remains, check the point from the other side. Most often, active points will be located on the side where the head turns worse. These tips have benefited many of my patients and can benefit you too. Post any questions in the comments and I'll do my best to respond. And suggest new topics for videos. Everyone created good subtitles.